Hi everybody, welcome to my channel. Today we're gonna talk about compulsions disorders. I'm Rita and today it's all about you. Common compulsions usually include washing or cleaning, checking doors, locks, and appliances in general in a very repeatedly way. These are rituals that are designed to try to prevent bad things to happen in the mind of a compulsive person. The cause may be genetic, which are the first degrees, of course, much more risky. Brain structures, because lately scientists have discovered some different functions in the frontal lobe of patients with compulsive disorders, but also can be caused by environment, like physical, sexual or emotional abuse can cause a trauma, and the way the brain deals with this trauma may be linked with anxiety, and this can lead to a compulsive disorder. There are some symptoms that we should all be attentive, not just because they are just different ways of behave or different ways of acting, but also these are things that can lead in the near future a much different kind and strong kind of behaviors that can really cause that a person is not able to live a normal life. So the first signs to be aware are giving too much attention to detail. It's something that it happens to almost everybody. That we all know people that are a little bit more perfectionist, as we call them, but there are other things that can be a little bit more dangerous. For instance, people that really need that some kind of objects have certain order, or that they need that things not just at home but outside home have a special way of being, of presenting, and so on. What I mean is that when you need a perfect symmetrical structure to go on with your normal daily life, when you obsess about cleaning, or when you have too many intrusive thoughts that really start to bother you, and that you know that it's not usual that this could happen. So all of these are signs that you have to be attentive, particularly if these happen not just inside your home but happens outside. And I mean, people always start to small uses, like being in a supermarket and really need to put some products in the shelf by a certain order, or go to a store and the clothes have to be in certain order of color, and the person just cannot deal with the mess and really needs to pick it up and put in this kind of order to be able to move on. And of course, all of this can really make you feel anxious, uncertain, insecure about yourself, and give you this kind of pain that you feel that something is not okay, and you know that these are behaviors that you just cannot control. Specialists have grouped the types of compulsions in different categories. Checking, which is an urge to check if everything is okay when you leave the house, if the lock is closed, if you close the door, if you close the window, you unplug the iron, if everything is okay in your oven, if things are not on. And there are a lot of different types, but they all mean the same kind of behavior and the same kind of feeling. Another thing is contamination, which usually happens with people that are really thinking about stay clean and have everything around them clean. This means that certain people with compulsive disorders start to have signs with these feelings of contamination. For them, everything needs to be clean all the time and constantly, because they keep being contaminated by others. Another type is mental contamination. This one is a little bit different because usually happens when somebody with a sign or starts showing some signs of compulsions. They receive some kind of criticism that they cannot deal with. They will perform a behave for a long time in a way of punishing the thoughts that they are trying to deal with, and usually are thoughts about low self-esteem and low confidence. Hoarding or accumulation is very common in a compulsive person. These are the kind of people that they cannot just throw out things, and they keep everything that they see and everything that they want, because for them is like a little treasure. Even sometimes it reaches a point that it's almost impossible to live in this kind of circumstances and with this kind of behaviors. The other thing is the rumination, which is a brain process that really is not able to stop thinking the same kind of thoughts. Usually we call it rumination also because it looks like a rumination, so it looks like this movement which is almost circle, but also constant and difficult to just end. And the last one is intrusive thoughts, which are usually these kind of fears that our brain just stick with, this kind of thoughts that we are all constantly thinking that something is going to happen that is bad. And it's a kind of fear that a compulsive person tends to obsess over. The most common compulsion is the obsession compulsive disorder, which we usually call OCD. So this is characterized by overwhelming thoughts and urges that are totally involuntary and impossible for a person to control them or even try to cope with them, even there's conscience about this kind of thinking, feeling and behavior. Obsessions, which are feelings, are the product of persistent thoughts, impulses or images that causes a really big amount of anxiety. People are aware that they are product of the mind, but they cannot control, they cannot cope with, and they cannot do anything different. On the other way, compulsions are the behaviors that result from these feelings, and they are repetitive behaviors or mental acts that someone performs as a response to an obsession. And the behavior is created to intend the reduce of stress, fear and anxiety. Other compulsive disorders that can be related are, for instance, the body dysmorphic disorder, which is a disorder that affects the image that we have of our own body. Hypochondria, which is irrational fear of diseases. Hoarding disorder or collationism. Hair pulling disorder or skin picking disorder. They all are coming from or linked from the group of compulsions. In life, we may sometimes feel a little bit stressed that are caused by our own feelings and caused by certain situations that we cannot control. And sometimes all of these things that happened in your life may eventually lead to really strong feelings and behaviors that we cannot control or cope with. And this is normal and happens to everybody from time to time. But if you are too overwhelmed about certain facts in your life that really affects your relationships, your daily life, your mental state, and your well-being in general, remember that mental health is something that is so important as physical health. And admit to yourself that seeking professional mental help is so natural as when you go to a doctor when you feel that you have some physical symptoms. Remember that are always different ways of seeing the same problem and always different ways to solve it. Life has different perspectives and different dimensions. You just have to work on yourself in a way that you feel ready to see them. So if you feel any kind of symptom that were referred here or any kind of sign that it's something that it's happening quite often and you are not sure if it's something that it's really worth to mention to somebody, but it's something that it's starting to annoy you and it's something that it really affects your well-being, please try to contact a healthcare provider and try to see if you can get some kind of evaluation of your case, and in the end you will get your answer and probably you will feel a little bit different about all of these signs and symptoms. It is important that you understand that it's usually nowadays very common that and even healthy that we treat our mental state as something important and so important as our physical one. So that's all for today, guys. I hope you like it. I hope you subscribe to the channel, leave a thumbs up, share with a friend, comment if you want, and I'll see you next time. Bye!